This is a baseball player from Glencoe, Minnesota, and his season is just starting. And he's a pitcher, and he just started pitching and started throwing and so forth. And what symptoms were you experiencing right off the bat?
Just soreness in my elbow.
And so this was hurting, it was kind of inhibiting your quality of pitching, is that correct?
Yeah.
And when you rested, it's kind of gets better, and then as soon as you start throwing again, it gets worse?
Yeah, that's about it.
So, as chiropractic kinesiologist, and we also practice SOT and neurology, we're going to look at his whole scenario here. We're not just going to look at his elbow, because the elbow is a symptom and it's not the cause. So we're going to look at his whole picture here, and we're going to evaluate why his elbow is not functioning as well as it should be. So let's have you on your back here, face up. So we're going to start out by testing his ankles. So I'm just going to pull on his ankle on the right side. And I'm not feeling any crepitation, and it seems pretty solid. There's not a lot of give in it. Come to the ankle on this side. Can you feel that giving in there?
It's cracking.
So his ankle is weaker on this side. It's got weaker ligamentous structures in there. Have you ever sprained it or anything, you know?
Not that I know.
Try to remember everything you do to yourself.
Yeah, that's true.
And now what we're going to do is test muscles on this side of the body compared to this side. And what we're looking at is muscle tonus. We're not looking at frank nerve root problems. I mean, if we find that, that will be an issue, but in these instances, many times what we find is a decrease in tonus that actually is coming from a decrease in firing from the pontine medular reticular area, which is in the brainstem, which actually creates tonus to the extensor muscles. And so we're going to test one side compared to the other, and we're not looking for frank weakness. We're looking for more of an instability. So bring your leg up, and I'm going to put pressure down, and you just try and hold it there.
Okay.
Then we'll come to this side and hold it up. Which one felt stronger?
Right.
Now we're going to test some of his extensor muscles on the outside of his leg.
Earlier or later?
We'll test this side.
Shoot for 2 o'clock.
Now we're going to test his low back extensor muscles.
Here.
I'm going to pull your legs towards me.
And left.
Because what's affected is the posterior muscles below T6 and the anterior muscles above T6 when we find a decrease in reticular formation output. Now this arm on him has a little more flexor tonus to it also. If we test his lat on this side, try and hold your arm in, and I'm going to pull out. It's got more weakness, and then his extensors in his hand. Try and hold this back. He's a pretty strong guy, so hold this back. Big difference in the hand muscles there too, isn't there? And this is his lat muscle on this side, his latissimus dorsi. Hold. There's quite a bit of difference here. And so what we're going to do is activate this side, which will bring back the stability to the arm and allow him to throw repetitively without his muscles, tendons, and ligaments taking a big strain, and he'll be able to pitch the whole game rather than have to get out and have to wrap his arm and do ice therapy and all that. Will actually bring the stability back to fix that. And so what we're going to do is some techniques with SOT category techniques. We're also going to play some music therapy for him, which will allow the stability to come back. We're also going to help him support his ankle here, because that's creating improper proprioception, mechanoreceptor, afferent information being sent back to the brain, which will weaken him also. So we're going to stabilize his ankle, which is a problem, and create stability on this side through all these techniques we just talked about. Thank you.